Eileen Veilleux The Fam here. Welcome to another Halloween special edition in our mini mental health series. And in this series, we are going to be covering what is called Alice in Wonderland syndrome, or better known as AWS. So, what is AWS? I've never heard of this Alice in Wonderland system. So you may ask what it is. Well, let me tell you. AWS, or Alice in Wonderland syndrome, is a rare condition that causes temporary episodes of distorted perception and disorientation. You may feel larger or smaller than you actually are. You may also find that the room you're in or the surrounding furniture seems to shift and feel further away or closer than it really is. These episodes aren't a result of a problem with your eyes or a hallucination. They're caused by changes in how your brain perceives the environment you're in and how your body looks. The syndrome can affect multiple senses, including vision, touch, and hearing. You may also lose sense of time. Time may seem to pass faster or slower than you think. AWS primarily affects children and young adults. Most people grow out of this disordered perceptions as they age, but it is still possible to experience this in adulthood. Now, AWS is also known as Todd syndrome. That's because it was first identified in the 1950s by Dr. John Todd, a British psychiatrist. He noted that the symptoms and recorded anecdotes of the symptoms of the syndrome closely resembled episodes that the character Alice Little experienced in Lewis Carroll's novel Alice Adventures in Wonderland. So how does this syndrome present itself? Well, AWS are different for each person. What you experience may vary from one episode to the next as well. A typical episode lasts a few minutes. Some can last up to a half an hour. During that time, you may experience one or more of these common symptoms. A migraine. People who experience AWS are more likely to experience migraines. Some researchers and doctors believe AWS is actually an aura. This is an early sensory indication of a migraine. Others believe AWS may be a rare subtype of migraine. Size distortion. Micropecia is a sensation that your body or objects around you are growing smaller. Macropecia is a sensation that your body or objects around you are growing larger. Both are common experiences during an episode of AWS, though. Perceptual distortion. If you feel that objects near you are growing larger or they're growing closer, that's another thing. Time distortion. Some people with AWS lose their sense of time. They may feel that time is moving faster or slower than it really is. Sound distortion. Every sound, even typically quiet sound, seems loud and intrusive. That's why they are associated with migraines, because when you have a migraine, that's the way it feels. Even a whisper feels like somebody's yelling. Loss of limb control or loss of coordination. This symptom occurs when muscles feel as if they're acting involuntarily. In other words, you may feel as though you're not controlling your limbs. Likewise, the altered sense of reality can affect how you move or walk. You may feel uncoordinated or have difficulty moving about as you normally would. So what causes this AWS? Well, it's not clear what causes AWS, but doctors are trying to better understand it. They do know that AWS isn't a problem with your eyes, a hallucination, or a mental or neurological illness. Researchers believe unusual electrical activity in the brain causes abnormal blood flow to the parts of the brain that processes your environment and experience visual perception. The unusual electrical activity may be the result of several causes. One study found that 33% of people who experienced AWS had infections. Both head trauma and migraines were tied to 6% of AWS episodes. But more than half of AWS cases had no known cause. Although more research is needed, migraine is considered the leading cause for AWS in adults. Infection is considered the primary cause for AWS in children. You can get it through like cough medicines, can cause it, use of hallucinating drugs, epilepsy, stroke, and brain tumor. Are there any associated conditions or risk factors in getting this? Well, several conditions are linked to AWS. The following may increase your risk for it. Migraines, as we stated before, AWS may be a type of aura or a sensory warning of a coming migraine. Some doctors also believe that AWS may be a subtype of migraines. Infections, as we had mentioned before, AWS episodes may be an early symptom of Epstein-Barr virus, better known as EBV. This virus can cause infectious mono or mononucleosis. Genetics. If you have a family history of migraines in AWS, you may have a higher risk for experiencing this condition. So how is it diagnosed then? If you're experiencing symptoms like the ones we just described for AWS, you need to make an appointment with your doctor. You and your doctor can review your symptoms and any related concerns. There isn't any one test that can help diagnose AWS. Your doctor may be able to make a diagnosis by ruling out other possible causes or explanation of your symptoms. To do this, your doctor may perform an MRI, which can produce a highly detailed image of your organs and tissues, including the brain. Electrosensitively, or an EEG. An EEG can measure the electrical activity in the brain, and blood test. Your doctor can rule out or diagnose viruses or infections that could be causing the AWS symptoms, such as EBV. AWS may also be underdiagnosed. This is because the episodes, which often last only a few seconds or minutes, may not rise to a level of concern for people experiencing them. This is especially true with young children. The fleeting nature of the episodes can also make it difficult for doctors to study AWS and better understand its effects. So how do you treat this rare thing called Alice in Wonderland syndrome, otherwise known as AWS? Well, there's no treatment for AWS. If you or your child experience symptoms, the best way to handle them is to rest and just wait for them to pass. It's also important to reassure yourself or your loved one that the symptoms aren't harmful. Treating what you and your doctor suspects is the underlying cause for AWS episodes may help prevent a further another episode. For example, if you experience migraines, treating them may prevent future episodes. Likewise, treating an infection could help stop the symptoms. If you and your doctor suspect stress plays a role, you may find that medication and relaxation can help reduce symptoms. Can AWS lead to complications? Well, AWS often gets better over time. It rarely causes any complications or problems. Although the syndrome isn't predictive of migraine, you're more likely to develop them if you have these episodes. According to one study, a third of people without a history of migraine headaches develop them after experiencing AWS. So what's the outlook for people that have AWS? Well, while the symptoms can be disorientating, they aren't harmful. They're also not a sign of a more serious problem. AWS episodes can happen several times a day for several days in a row. And then you may not experience symptoms for several weeks or months. So you'll likely experience fewer symptoms over time. The syndrome may disappear entirely as you reach early adulthood. And that is what Alice in Wonderland syndrome is. So there's still speculation on what it's about. It's still misunderstood. There's still a lot of questions about it. So until scientists comes up with all the proper answers, it's still a rare disorder. Not a lot of people have it. A lot of people that have migraines, don't all have that either. So remember that if you have migraines, it doesn't mean that you're going to have AWS. It is rare. Very few people get it. So, I'm hoping you're enjoying this Halloween special edition of rare mental illnesses that we don't ever hear about, that remind us of Halloween. We have covered different things from thinking you're a werewolf or thinking you're a vampire to walking corpse syndrome, which is like a zombie. So we've covered different things that remind us of Halloween, and I hope that you all have a great Halloween. In November, we will be going back to our regular, normal mental health series. This was just a special edition, since Halloween's coming upon us, to give you a glimpse of things that, there are some things that are triggered into Halloween. And if I can ask any parent out there, if you have a child, please be mindful of the stigma with mental health and do not dress your child in something that could hurt somebody with mental health. A lot of the Halloween costumes, besides things like I just mentioned, like if they show somebody in a straitjacket or something, don't get things like that because that does not help the stigma with mental health. Mental health is a lifelong problem. It's not just triggered by Halloween, but it can make matters worse for those that suffer with different mental illnesses. It can make them feel bad because they're misunderstood. That's why these series are important, is to help you to understand everything. Okay? And until I see you again, please remember to always see with your heart and not your eyes, because what your eyes see isn't important at all. What's truly important is invisible to the eye, because only the heart can see it. And remember, always speak kindness, uplift somebody, encourage them, or inspire them. Your words can either save a life or take a life. You may think something's not serious and it's just a joke. But to somebody suffering with a mental illness, that little joke could be the straw that breaks the camel's back. It makes them take their life. So think before you speak and think with the heart. Put others in front of you before you open your mouth. And remember, I love you for who you are because you were all uniquely made and you all matter to me. So until I see you again, I love you all. Bye.